In Gaza's collapsing health system, a silent disease is taking hold: Guillain-Barre Syndrome, or GPS. It turns the body's immune system against the nerves, leaving patients weak, paralyzed, and often unable to breathe. For Oda Masood, life has become a struggle. His wife's body has shut down, leaving her trapped and voiceless.
I carry my wife and take her to the bathroom. My wife does not walk. She is sick, and if the disease spreads further through her body, it can reach her lungs, and this disease can kill her.
Doctors say they are seeing more cases among young people, conditions that could be treated anywhere else in the world. Both the WHO and the Gaza Ministry of Health confirm a growing number of cases here.
The first cause is pollution due to bad sanitation in Gaza, due to destruction of the sanitation system from the occupational forces during this war. This is the first. Second, due to malnutrition, there is hypovitaminosis, lack of vitamin B1 and B6 and B12.
For many, paralysis begins in the legs, then the arms, and can reach the chest, making it hard to breathe. For 25-year-old Muhammad al-Masri, it started with a stomach pain and diarrhea, before he suddenly lost the ability to walk.
I had stomach pain, then my legs stopped moving. They told me I have GBS, but there is no treatment. I'm scared I will die.
Without a treatment, patients can become fully paralyzed. The WHO confirms Gaza has no stock of the IVIG treatment, the only medicine that could save lives. Already 3 patients, including 2 children, have died.
Every day something stopped working. First my legs, then the hands. Even breathing became difficult.
As the bombs fall outside, an invisible battle is stealing Gaza young from within. Guillain-Barre Syndrome is a disease that should not kill, is now leaving its victims powerless, paralyzed, and abandoned by a healthcare system in ruins. Hani Mahmoud, Jazeera from Gaza City, Palestine.
Right, to understand more about this disease, let's speak to Dr. Nour Sharaf, an emergency doctor who was in Gaza a month ago and saw cases of Guillain-Barre syndrome during her time working at Shifa Hospital. Thank you for joining us. You're joining us now from Dallas in Texas. Dr. Nour, anyone with an autoimmune disease can attest to how life-changing it can be, but this one specifically sounds absolutely horrific and terrifying. There's no cure, I understand correctly. Can you explain to us, for someone who's not a doctor, to understand exactly what is it and how can malnutrition or famine lead to it exactly?
Yeah, absolutely. Thank you for having me. So like you mentioned, Guillain-Barre is an autoimmune condition, which that means that the body starts to attack itself. Specifically, the body attacks the nerves that affect the muscles of the body. And that can be very dangerous because it can lead those muscles to stop working. Guillain-Barre itself is just kind of this big category in which multiple other variations of the disease present. But the most common way that it will present is with weakness in the legs that will move up towards the body. And essentially the most dangerous thing about Guillain-Barre is that it can affect the muscles that the body uses to breathe. And, you know, obviously that can lead to death from people not breathing appropriately. And it can be caused by many things, but the most common cause for Guillain-Barre is consumption of contaminated food. Typically, it follows a period in which a patient will have eaten something that causes a diarrheal illness. And then 1 to 2 weeks later, they will develop the weakness in their legs that again goes up into their respiratory system as well and can stop them from breathing. There are 2 treatments available for Guillain-Barre that are used, IVIG and plasmapheresis. both which are not available right now in Gaza. And are very difficult to obtain in general from anywhere in order to be able to even send them to Gaza. So it is something that requires international attention.
I mean, it sounds absolutely horrific, Dr. Nour. And of course, this just highlights the devastating causes of this man-made malnutrition and famine, because it's not just Guillain-Barre, is it? There's been several outbreaks of infectious diseases in Gaza because of lack of water, sanitation, hygiene. During your time there, what are the sorts of cases that you were coming across?
Yeah, absolutely. I think we need to remember that people in Gaza are currently living in very close quarters, and that was secondary to forced displacement. So we have seen people get sick from simply being in very small areas near each other. So a lot of patients would come in with nausea, vomiting, diarrhea. They're eating food that's contaminated. They don't have any type of refrigeration for the food that they're able to even cook at home. So that can lead to very high levels of contamination of the food that they're eating and result in these diarrheal or GI illnesses. We saw a lot of people with non-healing wounds. So a lot of the trauma patients that would come in with gunshots or burns or even shrapnel related from bomb injuries are not healing from the wounds that they develop because they don't have the proper nutrition in their body in order for their body to support the healing. It's a multifactorial process that, all stems from lack of resources, whether that's lack of medication, whether that's lack of food or proper sanitary water for patients to drink. All of that is coming together and causing a huge deterioration in the health of the population of Gaza.
And it's important to highlight that this wouldn't be happening, of course, if Israel wasn't carrying out this war with this blockade that it's imposed on Gaza, not just during the war, but before that. And when I talk about blockade, it's not just food or medicine, because many of the doctors like yourself have been trying to go back, and they're reporting now that they're being barred from entry. And certainly some of those that have been able to go in, sometimes they try and take baby formula, just as a simple example, and that's being confiscated. Can you talk to us about the process of trying to get in to Gaza with Israel controlling all of those borders?
Correct. The blockade of everything, the ability to enter pretty much anything into Gaza is truly devastating. People are being blocked from food, so it's forcing them to go to these aid distribution sites where they're being attacked. They're being blocked from access to clean water. And we as healthcare workers are being blocked entry into Gaza. So the process of going is a multi-step process. Once you apply through the World Health Organization, you are then approved to apply through COGAT, which is the Israeli side of the operation that has the final say as to whether or not any type of healthcare worker is able to enter into Gaza. Right now, the only types of healthcare workers that are even allowed to submit an application are physicians and nurses. So no respiratory therapists, no physical therapists, no nutritionists, and those are much needed individuals in this situation. Even physicians and nurses are being denied entry up to 24 hours before our trip. The only entry point right now into Gaza is through Amman, Jordan. And once we arrive in Amman, Jordan, we get the final approval to enter into Gaza about 24 hours before our trip. And, it is very devastating to see that as humanitarian, politically unaffiliated healthcare workers, we aren't able to go in and help the people who need it the most. And even myself, I was not denied entry, but I was denied the ability to bring in any type of medical supplies or any type of additional resources that would be able to help the patients there, which includes things like much needed medications. We talked about IVIG and how it's not available in Gaza, which includes things like resources. We were having to, while I was working at the hospital there, we were having to use items that were not necessarily indicated to be used in the situation that we were using them for. but we had no other choice.
Right, thank you.
And I wasn't allowed to bring in tools.
Dr. Nour Sharaf, thank you very much for sharing your experience as a doctor and what you've had to face there in Gaza, an emergency doctor. You were in Gaza a month ago.
Thank you.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.